Recently, the FDA and the CDC authorized anyone 50 and above to get a second booster dose of the COVID vaccine. Today, Cronkite News reporter Mayo McBride joined a meeting with a vaccine researcher where he addressed the need for a second booster.
The guidance also included children 12 and up for Pfizer and 18 and up for Moderna who are moderately to severely immunocompromised. Vaccine researcher and infectious disease specialist Dr. Gregory Poland shared his advice on whether people should get their second booster.
Variants are changing. Right behind BA2 is XD, XE, and XF, and don't discount those. XE is already causing chains of transmission in the UK, and nothing that's happened in the UK vis-a-vis COVID has failed to be reflected eventually in the US.
Dr. Poland says they've seen as much mutation with the SARS-CoV-2 virus as they normally see in 5 to 10 years with something like influenza. The recommendation for the second booster is based on the concern of another surge, evidence of the beginning of surges, and specific characteristics of the BA2 virus.
It is another 30 to 50% more transmissible than Omicron was, which was 50% more transmissible than Delta was.
Dr. Poland warned that because of how much the COVID virus is changing, boosted people may still be susceptible to the next strain.
The benefit of this second booster, if I have a normal immune system, is measurable, it's real, but it's short-lived.
He recommends for eligible people to talk to their healthcare providers to see if a second booster is right for them. In the newsroom, Mayo McBride, Cronkite News.
Governor Doug Ducey recently put an end to Arizona's state of emergency that he declared over 2 years ago in response to COVID-19. Today, as the pandemic starts to dwindle down, the state is also scaling back on updates of COVID-19 hospitalization data. The Department of Health Services director said that a surveillance order requiring hospitals to report COVID-19 data is no longer in effect. This ends graph updates that show data on hospital bed usage availability, specific metrics for COVID-19, and ventilator usage. This comes as COVID-19 hospitalizations have lessened significantly since the Omicron variant's January peak. On March 29th, 429 virus patients occupied inpatient beds, compared to 4,850 in late January.